You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, no matter how bad your teeth are or how bad your gums are, you can have the smile you've always wanted. So if you can't eat, you can't chew, we're talking about a lot of things today, including dental implants. With us, we have an expert on the topic, Dr. Dan Holtzclaw. Dr. Holtzclaw, welcome to the program.
Thank you, Randy.
I've actually wanted you here for quite some time. We finally kind of begged you to come in and do this, so thanks. I know you're a very busy center. Now, for people that don't know your practice, I mean, you're one of the most experienced guys in the business. And I'm not just, and people need to know, I'm not trying to side with you, but I mean, you do more in a week than most guys do in a year when it comes to implant dentistry or full mouth reconstruction. So who's the typical patient you see?
Really, the typical patient we see is everybody from all walks of life, no particular type of person. A lot of people think when it comes to dental implants, only rich people are getting dental implants. Absolutely not true. Everybody from all walks of life we see at the clinic, from the janitor at the high school to celebrities from LA that fly to the office to have treatment done. So we see all walks of life and all situations. Some people have gum disease, some people have cavities, some people have just bad genetics that they take great care of their teeth, but nothing seems to work for them. People that regularly go to the dentist, people that haven't been to the dentist in 30 years.
Okay.
We see
Really?
everybody.
They haven't been to the dentist in 30 years?
Yes, and there's a number of people, and the backstory on that is surprisingly very familiar and similar with all of these patients. Usually they had a bad experience when they were a kid, or they had a bad experience at some point in the past, and they avoided the dentist ever since. And then things finally get to a point where they can't take it anymore. Either they're in pain, they had to miss their granddaughter's, recital, something comes up that just is the straw that breaks the camel's back, and they say, okay, I have to do something about this. And many times just getting over that fear of coming to the dentist is a big step for these people. I've had to do consultations where the patient couldn't even sit in the chair. I had to have them sit in a regular chair in the corner of the room and just talk to them.
Because of their dental phobia?
That chair is like a monster to them. They will not get into that chair. And once they see that, we're dentists and still a normal person, we're not a monster, and we allay their fears and find out, what it is that is causing them to avoid the dentist. We can fix that for them. And those are the types of people that we see. So literally all walks of life, all types of people, and everybody always thinks they have the worst teeth that we've ever seen.
Is that right?
Everybody. We hear that probably every day. And for most people, what we could tell them is that you don't have the worst teeth we've ever seen, that there are many other people that are in your similar situation. And I think that's comforting for a lot of...
So do you think they think that they're the only people with bad teeth like that? Because these people never smile. Like, you never see them. Like, I don't see people with bad teeth walking around.
Well, and
except for movies when they're trying to show a poor person.
Yes.
But
or a bad guy.
Yeah, or a bad guy.
No, that's exactly true, because a lot of times when people have problems with the teeth, they sequester themselves inside their house. They don't leave, they don't go out to eat, they avoid friends, they avoid family, they avoid situations where they're having to be around a lot of people because of either A, they don't want people to see their teeth, B, they're embarrassed, they're afraid of their denture falling out or their partial falling out while they're eating just because it fits so poorly. We've had patients that talk about, I was in a situation, I was at a dinner, and everybody was eating a particular food, and I had to avoid that food, and people noticed, and it was, very embarrassing. Or I was in a situation with a lot of friends, we were all talking, I started getting very animated, and my partials started to fall out, and I immediately
Is that right?
caught, and and I had to excuse myself from the room because it was embarrassing, and I was wondering, did people catch that? And now people know that I have false teeth, and so they just take themselves out of those situations, and that's just the emotional side. Then you have the other patients that are in pain, and they don't leave the house because they're in just severe pain all the time. They're having to take a lot of medications, and
pain from their teeth.
Pain from their teeth, pain from just the rest of the body, they start feeling sick because they have so much infection in their mouth from gum disease, from cavities, failing root canals, a number of issues, and they feel run down, tired, just don't feel very well. And so there's a number of reasons that you do see patients that don't have very good teeth, that you don't see them outside a lot because they choose to stay inside a lot of times for all those various reasons. So a big portion of the patients that we see in our area are for dental implants. We are known for dental implants in all the cities that we're in.
Okay.
And the types of patients that we see quite a few denture patients who want to get rid of their denture. And many patients that have dentures, we can put them into a permanent fixed smile. That's not a denture. It doesn't snap in or out of the mouth. It is there permanently. And what's nice is we can do this in one day.
Okay.
Eliminate all the years of hassles of dentures, goops, goos, loose dentures, sores in the mouth, all that gone. Avoiding foods, gone. They can eat what they want, all taken care of in a single day.
All right.
Patients that have significant amounts of bone loss, who have been told that they can't have any implants, that there's no hope for them. We do specialized implants in the office that very few offices in the country do, to where we can put implants that anchor into very strong bone in the cheeks, which anchor into bone behind the sinuses. That's very strong bone that allows you to get teeth in a single day. Okay. Most other offices don't offer. A lot of offices don't even know what those are called. Okay. And so no matter how long you've been in dentures, 30 years, we can still do this in most cases.
Okay.
Then we have patients that have just a variety of ailments. So they have cavities, failing root canals, missing teeth, gum disease. Those types of patients, once you start adding all the costs up to try to fix everything, many times the amount of money involved, the time in the dental chair, the number of procedures that it's going to take, we can solve that in a single day with one procedure while the patient is asleep and give them a permanent implant smile.
Okay.
Then you have the other patients that don't need full mouth of implants. They just need 1 or 2 implants. They need bone grafting. They need a gum lift to make things look nicer. So there's a variety of things that we do in the office. It's not a one-trick pony. It's not one treatment for all ailments. We diagnose everything and offer the best solution to the patient that meets their desire, their budget, and satisfies really what they're looking for. I mean, they're not coming in to get a screw in their mouth. They're coming in to get a smile. They're coming in to be able to eat. They're coming in to get something fixed. They don't care if you're doing a screw or doing a surgery. They want teeth.
They want teeth again.
They want to smile again.
Now, moving on to today's topic, I guess dentists call it full mouth reconstruction. Give us a working definition of what we're talking about today. What does full mouth reconstruction mean?
Well, full mouth reconstruction is when obviously somebody needs more than a simple cleaning, needs more than one thing fixed. There's usually a variety of issues that the patient has, whether it's gum disease, gum recession, failing crowns, cavities, missing teeth. So when you have a variety of these things, many dentists will get tunnel vision where they'll zero in on one particular thing, but you really need to focus on the entire mouth and look at everything as a whole. When you're doing a full mouth reconstruction, it can involve a number of different procedures, from bone grafting to repairing cavities, to removing failing teeth, to treating gum disease, to doing dental implants. And you have to have a very well-rounded knowledge of everything, and you need to have all of those different specialties available in your office, because some of these treatments for these more severe cases, they're more advanced procedures. And when you have a variety of people in the office, such as we have with oral surgeons, periodontists, prosthodontists, that can handle all of the most difficult cases, no matter how hard they are, you can take patients that have severe combination of problems and get them to a point where you reconstruct their mouth to a point where they can smile again, chew again, and not have to deal with those problems.
Okay, now you're a periodontist, board certified periodontist.
Yes.
But also I guess you were in the Navy, but you also had training as a general dentist.
Yes.
Worked in hospitals. You've also published over 100 articles. You teach dentists across the country on on how to practice modern dentistry. Does it cost more to go to somebody like you?
No, and many times it actually costs more to go to somebody with less training. In terms of just straight out price that you pay, our price is about the same that you pay at any regular dentist that's not a specialist.
Okay.
And then if you...
But getting it done right the first time, that's the key here, right?
Yes, because that's what a lot of patients don't realize is that you may see somebody that has not done very many of these, and they do the procedure on you, and if something goes wrong or has to be redone, then now you've paid double. Many times you've paid triple because you had to have the bad work removed, then you had to have the problems fixed, then you had to have the work done all over again. So by going to the highest trained people first, you really eliminate the possibility of that happening.
And you do it all right there.
We do everything all in the office under one roof at one time.
And you do sedation on the bigger full mouth reconstruction cases. Is that right?
Yes. Over 40,000 sedation procedures we've done with our doctors in the offices. And these are true sedations where you're asleep for the procedure.
Like IV sedation is what you're talking about.
Yes, IV sedation, where many offices will say we perform sleep dentistry, and they're essentially giving you a pill, and you somewhat get a little relaxed, fall a little bit asleep with the pill, but you're still very aware and conscious of what's going on around you. The pills just make you forget a lot of things.
Okay.
Whereas with the IV sedation, one, it's significantly safer because we can give you medications and it takes effect instantly.
And you can pull them out?
And we can take people out of sedation.
Okay.
We can have better control of the heart rate, the blood pressure. It's much safer. Whereas when you're doing a pill type of sedation, which is what you typically get at most dental offices, you have to wait for that pill to go through the body, go through the digestion process, and then the medicine gets into the bloodstream. Well, you don't really have any control over that. And then if something is going wrong that you don't like, you can't reverse some of those situations where with the IV, you can do that. I mean,
people have to love to do it that way.
Oh, it's very
nobody
nice.
likes a dentist, right? You go in there, if you could go in there and relax,
have
almost amnesia about the procedure, wake up with teeth.
Most patients say, I remember talking, it's just like TV. We counted back from 10 and then I don't remember anything. I mean, it's very common for patients to say, I remember talking to you before we started, and then the next thing I know, I was waking up and you're putting the teeth in, and we're all done.
For the sake of time, I have questions here that I want to ask you about implants. In particular, if you're only missing one tooth, why a dental implant over a traditional bridge?
Well, in all cases, an implant isn't the best situation. Sometimes a bridge is better, and we look at those situations. So a bridge is basically two crowns with a fake tooth in the middle. So they're attached to two teeth, one on each side of where you're missing a tooth. So if those two teeth are broken down, they have big cavities, they have a number of issues, then sometimes a bridge is better. We can put basically two crowns on those teeth and replace the missing tooth, and everything's taken care of very quickly. Now, in a lot of situations, an implant is better because if either the neighboring teeth where you're missing a tooth is what we call a virgin tooth, it has no fillings, it has no cavities, there's nothing wrong with that tooth. To do a bridge, we have to shave the tooth down. So anytime you do that, you're damaging a perfectly healthy tooth. Anytime you shave a tooth down, you have the potential of irritating the nerve. Now you possibly could need a root canal. Also with a bridge, dental insurance will pay for a new bridge typically every 5 years.
So they last about 5 or 10 years?
Well, most dental insurances don't like to pay for a lot of things more than they have to. So if they're willing to give you a new one every 5 years, that tells you what they think in terms of their longevity.
Yeah.
So with a dental implant, we don't have to touch any of the neighboring teeth. We leave them alone. We place the implant between the teeth, and then we're able to restore it with a tooth that you treat just like your other teeth. You can floss around it, you can chew with it. It's not a bridge.
Is it less expensive in the long run over a bridge?
In the long run, I would say yes, because if any of the teeth in the bridge need a root canal, now the bridge costs more than the dental implant process. If the bridge has to be replaced over time, now you have spent more than the dental implant process. And if any of the adjacent teeth that are attached to the bridge fail, then you're going back to getting an implant. So if the end permanent result is an implant, why wouldn't you just get the permanent result right off the bat instead of delaying it and spending twice as much in the long run?
You brought some of these photos. What are we looking at? And these are all full mouth reconstruction cases. What are we looking at?
Let me show you first. First, we have Travis.
And you say this is life-changing. I'm sorry to interrupt, but that you do this, and is it really for these people like a big deal?
Completely for a lot of patients. Really, really life-changing. Take Travis, for example.
Okay.
If you look at Travis, you can see his upper teeth, you can't even see them when he smiles. His bottom teeth, you can see they're loose, they're yellowed, they're out of alignment. He's smiling with his teeth, even the way that they are. He still loves to smile, but you're going to make some preconceived notions about him. He doesn't take care of his teeth, and it affects your life because you can't have the confidence that you normally have. You can't interact with people the way that you normally do. Now, in one day, we're able to do a full mouth reconstruction case for Travis, and now take a look at his smile here.
It's looking good. Very nice.
He is happy. He has more confidence. Just his interaction with his coworkers at work is totally different. This is something that has given him a new lease on life where he was having to hide things before, and now he doesn't. Randy, take a look at Travis side by side.
Okay.
Look at how he looked at before the procedure and what he looks like now after the procedure. Just in terms of age, he looks more youthful.
He does, yeah.
He's happier. He looks more sophisticated now.
It's true.
He looks much more approachable.
And you say these people come in and they won't even smile. I mean, you have to ask them to smile. And so when this is done, are they like smiling all over town or posting things on Facebook?
We regularly have stories. Patients tell us, I was walking in the milk aisle at the grocery store and a random person came up to me and said, I have just been noticing your teeth and you have such a beautiful smile. And we hear that all the time, just random people coming up and telling them, not to mention friends and family. And that is powerful for them, and it just really boosts their self-esteem and their confidence, and not even talking about the health aspects or the ability to eat. This is just emotional, how it makes them feel and how other people now perceive them. The other benefits for this are huge. Now he can eat what he wants to eat. Before, Travis would avoid certain foods.
Okay.
Now he doesn't even have to think about it. And that's another common thing that patients will tell us is, if you have good teeth, or even if you have just average teeth, you don't think about what you have to eat. You just go somewhere, you eat. When you have really bad teeth, you're constantly thinking,
is that right?
Can I order this? Can I eat this? If I try to chew this food in front of everybody, am I going to have to worry about food getting underneath my...
And this is what they tell you on the consults.
Oh, well, they don't tell us at the consult. A lot of times they tell us after, because
it's all done.
Now that they have the procedure finished, they say, thank goodness I don't have to deal with that anymore. I'm so happy. I don't even have to think about this anymore. Where before, it was the first thing I would think about. Where are we going out to eat? Can I eat that type of food? Now I don't have to think about it anymore. And they said, that's huge. They said, it's a burden, it's a weight lifted off of your shoulders that the typical person doesn't have to think about because they have teeth that are healthy or they have teeth that are even normal. And when you're in a situation such as this, to where you can go from having teeth that are loose, that are missing, that now you have a permanent, strong smile. You can do those things and take them for granted just like everybody else now, whereas before you couldn't. It was one of the dominating thoughts of your life. So here we have another patient.
All right.
And you see this patient in particular, his teeth, he doesn't like the way that they look, but you can see that he's missing his back teeth. And when you're missing your back teeth, it really affects what you can eat because you don't have any molars anymore.
Okay.
And the molars are where you're grinding all of your food. So now he's forced to eat with his front teeth. They're not really designed for that. They start to wear down. They start to get loose. And so he had to avoid a lot of foods. So now by having a full mouth reconstruction in one day where we're able to give him a new set of teeth, now he has back teeth to chew with.
He's looking good.
His smile looks better, which is a side benefit. But for him, he really wanted improved function. We look at this patient. This patient was a family friend of one of our employees. She had cancer treatment. Now, when you undergo cancer treatment, many patients will start to have a lot of dental problems. She was losing teeth. She didn't like the way her smile was. She had to avoid a lot of foods. And now we look at her smile afterwards. Just look, she looks like a completely different person. Her demeanor's different, and you can tell that just from the picture. I mean, she's smiling literally from ear to ear.
This is a great shot, her holding her before.
Yes.
Now, when they look at their the mirror for the first time, are these people, I mean, are they getting choked up?
Oh yeah,
Sometimes?
It's very common. We see a lot of tears in the office with the patients and the staff on a lot of occasions, because every patient has a story, and every patient's story, you know, when you hear it, the before story will make you cry because you're hearing what they had to go through, and then the after story will make you cry because now you hear how happy they are.
That's good.
You know, so yes, so that's very common. You know, another person, Susan here. Now Susan, her teeth were still, you know, very savable here, and she had just a lot of issues. She didn't like the way her smile looked. She had a lot of cavities. She had a gummy smile. There were a variety of ailments that she was having, and we were able to treat her in a single visit with the IV while she's asleep and give her a smile that looks like this.
Wow.
You can see the difference in her smile. She has a bigger smile now. She's happy, just even the clothes she's wearing, the dress, she's carrying herself more confidently.
Now, a lot of these cases, a lot of these patients, that they would have had to go to the endodontist, the prosthodontist, the periodontist, the oral surgeon, the periodontist, the lab, and you're able to do it right there.
Yes, all in one roof.
Because this is your setup, right? I mean, this is...
Exactly. And in the past, that's what she had to do. When she was seeing her general dentist, she had root canals. She had to go see the endodontist for the root canal. She needed gum disease treatment. She saw the periodontist.
So you do it all right there?
Yes, we do it all right there in-house, all under one roof. And that's the beauty. It's nice for the patient. It also gives them more comprehensive care with continuity. Everything is done together. We all can talk to one another.
And it doesn't cost more to go to a guy like you. They don't need a referral to see you, right? You can go directly there, and you'll go after their insurance. I mean, you will try to get every penny out of their insurance, you said.
Yes. So, for example, this patient, with a full mouth reconstruction, there's so much work involved. No matter what your dental insurance, you're going to get the full maximum benefits from it.
Okay.
Because these are complex cases that involve a lot of treatment. And that's where it's good to have the specialists that have done thousands of these procedures. So you look at him before, you look at him after, I could tell you that
wow, good for him.
He had been treated by a number of specialists, a number of different dentists, and he had gotten to a point where they said there's nothing else we could do, but we were able to get him teeth
We're out of time, but time for one more. We've got about a minute left.
Okay, so I'm going to give you one of the most extreme cases I've ever seen in my entire career. This person, these are actual dental bridges. Now they're temporary.
Those are bridges?
Yes, believe it or not, they are temporary dental bridges, but the work in this patient's mouth was so poor that he had been in those temporary bridges for over 5 years.
He was like this for 5 years?
5 years.
So he just never smiled?
Never smiled. And the dentist that did that work ended up losing their license.
Okay.
And he went to many other dentists in town to try to get his situation fixed, and nobody would touch him. And he got to the point where he finally came to see us and said, if you can't help me, I'm going to commit suicide. I'm to that point. And in one day, with our full mouth reconstruction, everything in-house, we were able to get him to this.
Oh my goodness.
And you can see in that picture, you can see the tears in his eyes in that picture. It makes me choke up thinking about it. But
it's very nice.
The thing with him is we gave him his teeth. He hadn't been out of his house in nearly 5 years. You know, it affected his work. And the first thing he was going to do is his 90-year-old father is in the waiting room. As soon as we have his teeth on there, he's taking him to Cooperstown to go to the Hall of Fame, Baseball Hall of Fame, and been wanting to do that for the last 5 years, but couldn't because he had that in his mouth. And what would have happened if his father would have passed away during those 5 years? He missed out on that because of his teeth. And now...
So now it's all behind him.
It's all behind him. But you see, when we say it affects somebody's life or totally changes their life, that's a perfect example. This person has done things with his father that he put off for 5 years. Changes the way he interacts with people, period, because he never left the house. Imagine not being able to go outside because people think you look
Okay.
like a monster.
Wow. And this is good stuff, and we are completely out of time. Final message, though. Somebody watching this, and for whatever reason, they have really bad teeth, but they're afraid for whatever reason. They've even heard what you had to say. What do you say to them?
What I would say to those type of patients is that there is hope. And a lot of patients lose hope because they either have fear that they think they can't overcome, or they think that nothing can be done for them,
Okay.
or they've even been told that nothing can be done for them. With the full mouth reconstruction that we do in our office, with the specialists that we have in the office, with the laboratory personnel, with the most modern equipment in dentistry that we have in our office, there is almost no situation where we can't help you. And if you have the fear that is preventing you from coming in, we've done tens of thousands of sedations. We take that fear away. So you're
Okay.
going to have the best care. You're going to have it done while you're asleep. So my message would be, don't put things off. Come in for the consultation.
It's a free consultation.
It's a
to
free
see you.
consultation.
Okay.
It's a free CAT scan. Where else are you to go where you can find out all your problems, a possible solution to all your problems, and it doesn't cost you a penny to learn all of this. Everything's free at the consult, everything's free at the visit, and there's no obligation. You know, if you come to see us and you don't sign up for treatment, that's fine.
And you're big on financing. I mean, a lot of people are financing because insurance only, even with the best insurance, max payout might be a $1,500 or $2,000. But a lot of people are financing this. Medicare, Medicaid does not cover big procedures. Is that correct?
That is correct. I wish they
financing.
did. So financing, yes. So, you know, every patient that comes in is not paying cash for these procedures, you know, unlike what some people think. The typical patient having a full mouth reconstruction done is financing the procedure.
You're not carrying this yourself, so you have to have decent credit. You're going through lenders. Is that correct?
We do go through third-party lenders,
Okay.
but we also have the ability to help people even with poor credit.
Okay.
Because we do so many of these procedures, we have relationships with certain third-party financing programs that will finance patients with bad credit, finance patients with slow credit,
Okay.
finance procedures based on no money down, finance procedures based on some money down. And we will work with all the patients. We have dedicated personnel that all they do is try to help you get your teeth. We want you to have those teeth. We just have to figure out what works with your particular situation to get you those teeth. I know we can do the surgery. I know we can do the restoration. Now we need to make sure that we can also help you have the ability to do it in terms of paying for everything.
Okay, good. I want to thank you for coming to the show. Good stuff.
All right.
Thank you. And they can go to your website, make an appointment there, look at some of the before and after photos.
Yes, hundreds of before and after photos, information about financing, information about the procedure, information about all the doctors there, and diadentalimplants.com.
All right, thanks again.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.